Hello, my name is Douglas Overby, and this is a recording for emergency preparedness. And I'm going to be discussing the Joplin tornado disaster that occurred in Missouri in 2011. Joplin, Missouri is in Jasper County. It's in southwest Missouri. The population is about 50,000 people, but during the daytime that surges up to 270,000 people. There's two main hospitals in that region right across from each other, St. John's Regional Medical Center and Freeman Health System. Those are the two big receiving trauma centers that are around the area. But most importantly for this event, the city of Joplin in its entirety is located within what's called Tornado Alley, an area very susceptible to the formation of tornadoes due to the storm fronts that come through. So on Sunday, May 22nd of 2011, was a particularly bad storm. There were cold and warm fronts that created a supercell from Kansas and extended down into southwest Missouri. The timeline of events started at 1:35 p.m. where a tornado watch was called out for the area. At that point, hospitals execute severe weather plans. About 3 hours went by to 4:45 p.m. when storm chasers noticed as the storm was developing that there were multiple vortices out west of Joplin. Shortly after, this was upgraded to a tornado warning, which is where hospitals move patients into safer places. And then there's pre-established areas such as hallways, and everything's dictated by emergency operation plans at that point where patients are taken next. 5:17, 5:31 p.m., there were two separate emergency sirens, and we'll get back to why that's important later in the talk. But at 5:42 p.m. was when the actual tornado struck. Security guards were yelling, "Take cover." They knew a tornado was immediately impacting the building. And about 45 seconds was the duration of the tornado impacting. At this point, it was the hospital, which is where a lot of these accounts are from. They describe it as a large locomotive that ripped through the hospital. Glass was shattering, light bulbs popping, walls collapsing. All the kind of awful scenarios that you think of when a tornado is directly striking a large facility. So in the disaster cycle, here we are on the right side of that equation where preparedness, those emergency operations plans were just starting to be implemented, and the actual disaster was striking. You can see the path in the bottom right here. In St. John's Regional Medical Center is that yellow. On the left side, the tornado moved from west to east, and it wound up impacting a Walmart, Home Depot, a school that luckily was empty, and then two other schools that also had low attendance, and just causing total destruction. So in the short term, as it struck Joplin, which is within Jasper County and Newton County in Missouri, that's the path that the tornado took. It was an EF5, which is the absolute highest category for tornado, greater than 200-mile-per-hour winds, 3/4 to 1 mile wide swath that this thing took out, and a 6-mile long path right through the center of Joplin. They had a complete evacuation of St. John's Regional Medical Center, which had 183 patients as well as 28 critical care patients. And then overall, after this tornado, unfortunately, there were 161 fatalities and almost 1,400 injuries. That made it the deadliest tornado that has occurred within the past 60 years preceding it. Longer term, of course, there were a lot of structural damage to the city of Joplin. So that was the hospital that we mentioned, the Walmart, Home Depot, a lot of large commercial centers, and then a junior high school. Those are the major buildings that received the most damage, but also 7,000 homes, some of which were totally destroyed. 11,000 residents registered for assistance. Over 500 businesses had to close temporarily. 15,000 vehicles were damaged. And for an estimated total cost to rebuild this city was over $2.8 billion. And then, of course, mental health impact from this. Overall surveys show that 27% of the population there had PTSD at 2.5 years after the event. So a lot of long-term effects from this tornado, as you would expect. So the timeline of responses after this occurred, of course, right after it impacted, staff around the area said the scene was like a bomb went off. Their initial priority was evacuating the hospital. That was the greatest density of population in the path of the tornado. So within 90 minutes, they knew immediately they had to evacuate the hospital. It was no longer a safe place for the patients or anyone else to be. Emergency responders and the public, of course, conducted search and rescue operations. But the tornado within the city of Joplin was noted to quickly overwhelm the capabilities of that city. So Jasper County was mobilized, Newton County, And then, of course, it escalated, as we've all learned, to the state, federal levels as well. And there was an enormous input as well from non-governmental, private, nonprofit, voluntary organizations. They already had existing mutual aid agreements between the counties with regional partners, and so all those resources were mobilized. And then in particular, Southwest Missouri Incident Support Team was there to support the Incident Command and Emergency Operations Center. So to stratify these responses within the community, as the tornado hit, of course, within minutes, local residents showed up, pickups, SUVs, started offering to help transport both patients that were in the hospital originally, and of course, new victims and individuals that were wounded, and taking them to the nearby surrounding centers that were still functional. Within hours, over 100 EMS units arrived from surrounding states. That's important because the roads were still being blocked off at that point. There was still a lot of debris and damage, but still they were able to get around those and show up to help with the event. There was a makeshift MASH center that was set up miles away at Memorial Hall. That was all part of the emergency operations plan as the alternate site for treatment. And so from the Joplin Hospital that was destroyed, this was the next site that they were planning to transport some patients to and then begin treatment at that location. Over 400 public safety organizations deployed Joplin to help with the response operations as well. Nearby hospitals, like I mentioned, there's two other ones that were close. So Freeman Health System, that's the biggest one. I'll go more into depth about them in a minute because they received over 1,000 patients from this disaster. But of course, they began just assessing their own structural integrity, requesting supplies, preparing for a surge. And their chief clinical officer was the incident commander at that hospital. And the Landmark Hospital was also just down the road. And they began preparing for a surge, establishing a triage area, and then also sending what available staff did not need to stay at that hospital off to help with evacuation assistance from the destroyed Hospital of St. John's. So just one example of how a hospital that's nearby that is still capable could respond to this. So a timeline here in the first 2 hours, this is Freeman Health System. So they're the other bigger hospital that's right down the road. So you can imagine over 200 patients from the other hospital in need immediate care, and then in addition to all the new victims, which are numbering well over 1,000. So in the first 2 hours, they're on generator power. They get 180 patients within the first few minutes that show up to the emergency room. No surgeons, no operating staff on site, and they can't get those people there because of the power outage, and so communication is difficult. They don't know what damage there is to their own facilities, and because of the communication issues, also don't know what extends beyond the community as well. So their initial reaction was verify bed availability, open surgical suites, get current staffing levels, supplies, open a warehouse for supplies, and then start the structural assessments and inspecting for safety at their own institution. In the following 2 hours after that, they've had over 400 patients at this point. They're already operating at capacity, significant debris outside. They began cleaning up with that. And then still, the EOC nearby is not completely functional and set up yet. So they're still operating under their own incident command at this point. And unfortunately, another issue you run into is that there's inadequate morgue space. So they began establishing a temporary morgue, and then, as I mentioned, get debris removal underway, get those additional supplies that they need. So that's the timeline of a hospital to respond to this. And I bring it up only because in many of the lessons learned reports, this hospital was commended for their actions in terms of receiving the victims and how well they performed according to the plan afterwards. Of course, from the public health perspective, there's a lot of key players and participants to go into this. So the local level, Joplin City Health Department was issuing resources and trying to set up those command centers. Freeman Health Center we just talked about. Jasper County Health Department, although not very large, they do offer additional staff from the surrounding counties, and so those were all mobilized. At the regional level, Crawford County Health Department is nearby, Greene County Sheriff's Office. Each of them immediately sent staff and clinical personnel to come help with this. The Missouri Homeland Security Region D is in the southwest of Missouri. That includes 18 counties, and so they were also mobilized. Southwest Missouri Incident Support Team was there to help set up the new incident command and continue with that structure of NIMS. At the state level, the Missouri Hospital Association, they were very involved in this afterwards, especially with the review and lessons learned of, especially on the hospital side, how well they performed. State Emergency Management Agency, DHHS, Disaster Response System, of course, everything at the state level that they could offer in terms of assistance was mobilized. And the national level, FEMA, American Red Cross, CDC, many governmental agencies would all long-term be involved in this. Over 18 national federal agencies were involved in this disaster. So the ICS role initially, as the tornado hit, there were 2 designated incident commanders at the hospital's east and west sides. They were coordinated by the sheriff's department, focused on the evacuation originally. ICS then unified command for Mercy Hospital. They established that alternate site at Memorial Hall according to the plan. And then that would go on to become the incident command structure. Meanwhile, all the other hospitals nearby, of course, were undergoing their own plans, as we talked about, both with Freeman and Landmark. And so they were under their own IC at that point still. But eventually, Mercy Hospital St. John established the incident command at Joplin Convention Center for further planning. And that's whenever the state disaster management teams and higher organizations became more involved with the recovery efforts. And you can see the tent there in that picture. American Red Cross was setting up as well to help with this disaster. So by agency, the Joplin City Health Department, they helped assist with setting up the Memorial Hill treatment site, establish communication, stratify and address needs, and mainly began acquiring supplies that would be needed for further help with this. The Jasper County and Missouri Health Department, of course, also assisted with that. And then joint field operations of FEMA had been established at Columbia just due to flooding that had recently occurred. So they already had a lot of funding and resources in Missouri. And that's one thing we'll come back to later, but their directive was 1980 for that. So they could have staff there within 24 hours of the emergency. After the tornado, the state of Missouri amended it to include assistance with the Joplin tornado. And the CDC investigated infectious diseases. Those were some fungal infections from wet hospital conditions. And eventually, later down the road, they worried about lead levels and other things that had happened just from contamination of drinking water, gray water, those kinds of things. The HHS declared them an emergency, as you would expect, and the numerous nonprofit response groups also sent additional personnel, such as the Red Cross that we mentioned earlier. In terms of the community preparedness for this event, most of the lessons learned reports all show and demonstrate that the community was pretty well involved. Certainly from FEMA's standpoint, they said the whole community responded to Joplin, Jasper County in their hour of need. They thought the response was pretty well done. And then the preparedness partnerships were also, of course, very, very important in terms of preparing the hospital, the city, everything for this. That was federal, state, local, private, voluntary, and nonprofit entities. And from the director of quality at the Regional Medical Center, he said the most important thing they did was having a good plan in place, preparing, had a written plan and a good plan for response as far as setting up our incident command structure and following when the tornado hit. So this is, I think, is a prime example of why these plans are important and how quickly they have to be implemented. In terms of assessing the response, a lot of these were evaluated by other organizations. So the Joint Commission said plans and exercises did not fully address the devastation, overwhelming patient surge that resulted when a highest category tornado wiped out half of the healthcare resources. And there were no step-by-step instructions for response of this magnitude, but the emergency plans provided staff with the skills needed to critically think and react. And we'll come back to that as an important factor here. But major strengths of the response that were touted by these agencies, they said regional capabilities enabled needs to be met almost immediately. Social media mechanisms were used effectively, and participation in the national level exercise 2011, just earlier that year, had helped to prepare all the personnel to be involved and coordinate well for this disaster. FEMA also coordinated well with the city. Those were some of the quotes from the reports about how well the city and emergency preparedness plans worked. Of course, with any of these, the reports downstream, these are a few years later, these come out, show that of some important lessons learned. So in terms of planning, emergency operation plan, as I mentioned, should provide critical thinking skills rather than step-by-step instructions. For the incident command systems, the Joint Field Office for FEMA did experience some coordination challenges. As I mentioned, they were there primarily for flooding, and the hospital incident commands had taken over initial responsibility for this. So in the transition phases there, they did notice some issues with coordination. From the FEMA standpoint, incorporating that into the flooding declared disaster offered challenges for operations because they were slightly restricted, it sounds like, as opposed to calling this a new disaster and operating under that framework. So that was one lesson learned. In terms of resources, they did mention that establishing a dedicated person early to evaluate supply levels, monitoring use, and anticipating needs is helpful. That's something that the other hospital systems did nearby, but in terms of Joplin St. John's Mercy Hospital itself, they did not do that early, and so they noticed that there were a lot of supplies that did not get transferred from the hospital to the alternate treatment site in a timely fashion. That includes things like narcotics. From the utility standpoint, there need to be redundant systems and agreements for auxiliary sources. And from the staffing standpoint, managing and supporting staff during response is likely the most important planning consideration. From a volunteering standpoint, they need to have a plan to divert or accept, and then also credential volunteers. There were a lot of people that showed up, and when the power was down and communication outlets were broken, they could not immediately credential those volunteers to help with the assistant plan. So additional things that they noted. The medical surge, that was seeming to be well done by the nearby hospital, as I mentioned, but planning for a transition as well, whenever your hospital is overwhelmed and the triage areas are full, that was an important lesson learned. And then, of course, from an evaluation standpoint, planning for failure, testing to failure, just testing these schemes as much as you possibly can so that you're fully prepared. Community resilience is often thought, as we've learned a couple weeks ago, to represent how well a community can bounce back from these kind of events. The hospital staff were also noted as victims who must respond, so they demonstrate their own resilience. But in general, the community was seen to be very strong. They quoted as saying, "The smart, selfless, immediate response of the professionals during this catastrophe proves that the surrounding community is special." Most healthcare workers still reported a workplace disaster, even though they required additional support services such as alternative childcare. And even surveying them later, people were still saying that they're more willing to work in a future disaster compared to before the event. The hospital quickly bounced back just 4 years later. Residential areas, they developed a team and rebuilt the houses. 1 per day was the average rate that they were rebuilding after this. And that additional organizations such as the Joplin Homeowner Assistance Program and the citizens' input were also used to help redevelop this community. By 2015, the population had already surpassed the original census, and then businesses were all rebuilt with almost $1 billion worth of commercial buildings. So pretty quick bounce back from their standpoint. Hospitals, are just one part of the public health perspective, but for this particular disaster is very important. So we always have to consider hospitals being a unique hub because they're also a critical component of the emergency response system. So they have to demonstrate their own resilience processing. That's planning, equipping, training, exercises, all the things that seem to be well done from the Joplin Hospital standpoint, but also have to be considered from the nearby hospitals. And so the Joint Commission is very involved with credentialing hospitals to demonstrate this preparedness. And then also there's a Center for Domestic Preparedness Training that this particular hospital's director had actually attended and said that it was about as close as you can get to the real thing. And that was thought of as being an excellent trainer for him to demonstrate as good of a job as he was able to do during this particular disaster. Effective changes after this, Joplin improved their building code. They built a newer, stronger hospital that was pre-cast with hurricane-proof concrete walls, impact-rated laminate windows. And then they also noted the incident command post for places that tornado risk should be located underground. And so community schools were rebuilt with storm shelters that could serve as those incident command posts, but also they could accommodate not only the school, but all residents within a quarter-mile radius, and they automatically unlock when a tornado watch is issued. They also developed a regional activation policy for outdoor sirens. Like I said, there were 2 sirens here, and that was confusing for a lot of individuals. So they provide more education and try to make it more clear about what those sirens mean. And as you can see in the bottom here, they assessed all this over the years going by after the tornado, and they did notice quite a bit of improvement demonstrating effective changes related to this. For the ICS structure, changes that they noted were that they should partially activate ICS during an early weather incident, make sure the commanding officer and chiefs only do 1 to 2 hour shifts here, stop and review the progress, and have good security. Communication, of course, is always important in these particular things, and they noticed that the public information officer should be addressing the media perhaps a bit earlier than this case they were able to. And then they need to have separate hotlines for communication staff. They have to manage credential volunteers better, as I mentioned earlier. So in conclusion, this was a rapid, enormous, severe disaster that tested preparedness and response. There were many levels of organization involved that were critical to an effective response, and it was seen to be generally well implemented with some downstream changes from the lessons learned that were able to improve the response. And I would say overall, Joplin, Missouri demonstrated strong resilience. As you can see, the new hospital down there in the bottom right was already rebuilt, as was the rest of the community. And those are my references. Thank you.